home remedies are okay as long as there's nothing serious going on. I always think it's a bad idea to take one medication to make up for the problem caused by a different medication, because that's the way you end up taking more and more medications. However, if the constipation is likely to be due to a dietary change, then rather than taking a laxative, just improve your diet. Laxatives are okay for temporary relief of constipation, but not for long-term relief of constipation without seeing your doctor. There are a large number of laxatives that are prescribed for patients with constipation, but I always try and target the laxative depending on what I think is the cause of the constipation. So, for example, one of the common causes of constipation is weak peristalsis that goes with getting older. There are lots of things that go with getting older, and unfortunately a lazy colon is one of them. So as we age, the colon muscle, I guess from a lifetime of work, starts to become less and less effective. We're prone to constipation. So what I'm looking for in patients that I think have the constipation that goes along with aging is something to give the muscle a kick along, to improve the peristalsis. So there are two things that will do this quite effectively, and one is that as simple as taking prune juice or prunes, perhaps with your breakfast cereal. It might do enough to correct that sort of age-related constipation. Laxatives that have the senna alkaloids in them are also effective in this regard. Sometimes the colon just needs to be washed out a bit more frequently. The stool is sticking to the lining of the colon and it's not moving through the way it should. And so a watery laxative, such as these polyethylene glycol preparations, similar to what's used for a colonoscopy bowel prep, but less amounts, is what's needed. Sometimes stool softeners can be effective, but I like to, again, target those to patients that just have hard stool and regular peristalsis. So making a diagnosis of the cause of the constipation is important when prescribing the right sort of laxative.